Breast cancer is a disease that occurs when some cells in the breast grow abnormally and form a tumor. Sometimes, even after treatment, some of these cancer cells may survive and cause the cancer to come back. This is called breast cancer recurrence. There are different types of breast cancer recurrence, depending on where the cancer comes back. It can come back in the same breast, local recurrence, in the nearby lymph nodes, regional recurrence, or in other parts of the body, distant recurrence. The risk of breast cancer recurrence depends on many factors, such as the type and stage of the original cancer, the treatment received, and the genetic characteristics of the cancer cells. Some types of breast cancer, such as inflammatory breast cancer and triple-negative breast cancer, are more likely to come back than others. The stage of the cancer indicates how large the tumor is and how much it has spread. Generally, the higher the stage, the higher the risk of recurrence. The treatment received may include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, or a combination of these. Different treatments have different effects on reducing the risk of recurrence. The genetic characteristics of the cancer cells may also influence how they respond to treatment and how likely they are to come back. For example, some cancers have receptors for hormones or proteins that make them more or less sensitive to certain drugs. Breast cancer recurrence can occur at any time after the initial diagnosis and treatment, but it is more common in the first 5 years. The average time for breast cancer recurrence varies depending on the type and stage of the cancer and the treatment received. For example, most local recurrences occur within 5 years of a lumpectomy, surgery to remove only the tumor and some surrounding tissue, but this risk can be lowered by receiving radiation therapy after surgery. For people who have a mastectomy, surgery to remove the entire breast, the risk of recurrence depends on whether the cancer has spread to the lymph nodes and whether they receive radiation therapy after surgery. Breast cancer recurrence can cause various symptoms depending on where it comes back. Some common symptoms are: 1. A new lump in your breast or chest wall. 2. Swelling or pain in your armpit or collarbone area. 3. Persistent cough or difficulty breathing. 4. Loss of appetite or weight loss. 5. Severe headaches or seizures. If you notice any of these symptoms or any other changes that worry you, you should see your doctor as soon as possible. Your doctor may perform some tests to check for signs of recurrence, such as a physical exam, a mammogram, an ultrasound, a biopsy, a blood test, or an imaging test. Breast cancer recurrence can be treated with different options depending on the type and location of the recurrence, your previous treatment, your overall health, and your personal preferences. Some possible treatments are: 1. Surgery to remove the recurrent tumor and some surrounding tissue. 2. Radiation therapy to kill any remaining cancer cells in the area. 3. Chemotherapy to kill cancer cells throughout the body. 4. Hormone therapy to block or lower the effects of hormones that stimulate some types of breast cancer. 5. Targeted therapy to attack specific features of the cancer cells that make them different from normal cells. 6. Immunotherapy to boost your immune system's ability to fight cancer. 7. Clinical trials to test new or experimental treatments that may be more effective or have fewer side effects. The goal of treatment for breast cancer recurrence is to control the disease and improve your quality of life. Sometimes, a cure may be possible, especially if the recurrence is local or regional. Other times, a cure may not be possible, but treatment may still help you live longer and better. This is often the case for distant recurrence or metastatic breast cancer. Breast cancer recurrence can be a very challenging and emotional experience. You may feel shocked, angry, sad, scared, or hopeless. You may also have physical and practical concerns about your treatment and its side effects. It is important to seek support from your healthcare team, your family and friends, and other sources of help, such as support groups, counselors, or online communities. You are not alone in this journey. I hope this information helps you understand why breast cancer comes back and what you can do about it. If you have any questions or concerns, please feel free to ask me on the comment below. Thanks for watching. Please do not forget to subscribe to our channel.